This is Dr. Vinay Samuel Gaikwad, Director of Surgical Oncology at Birla Hospital, Gurgaon. This video is going to be about how we can preserve the anal passage for patients with very low rectal cancers. This is a very common and vexing problem for many patients who have low rectal cancers. So usually, especially in the past, most patients were offered a surgery called an APR, or abdominal perineal resection, which means removing the tumor and removing the anal sphincters, and therefore the patient would have a permanent stoma. With new technologies and new techniques that have come out, we're able to do sphincter preserving surgeries. So usually with patients with low rectal cancers, we offer the patient either neoadjuvant, that means pre-surgery chemoradiation, or TNT, which is total neoadjuvant treatment, which means chemotherapy as well as chemoradiation. So this shrinks down the tumor, maybe shrink it so much that we get a good gap between the tumor and the anal sphincter complex, which is very important to maintain continence. So once we're able to get that gap and get a good margin, we're able to perform what is called an intersphincteric resection, which means we perform a surgery to remove the rectum but preserve the external sphincter, which is very important to maintain functional outcomes and continence. So we do this mainly in today's age through robotic surgery. The robot helps us to go way down into the pelvis near the rectum, preserve the nerves, preserve the sphincter, as well as get a good margin so that the oncological outcomes, the tumor recurrence rates go down. So the robot helps us with a magnified vision and a better range of motion for the surgeon to make sure that we are able to remove the tumor completely and preserve the sphincter. One way to do this is called an intersphincteric resection that we discussed. Another technique that we perform is a TAMIS, TAMIS, transanal minimally invasive surgery, in which we perform this surgery without removing the rectum, without any incision, but it's done transanally. The tumor is completely excised and repaired through laparoscopic instruments. So there are many techniques that are now being used to perform sphincter preserving surgeries, saving the anal passage, and it is very much possible, but it should not be done at the compromise of leaving any tumor behind. So as long as we're able to remove the tumor completely, we can save a patient from having a permanent stoma. So I hope this video has been helpful as how we can perform sphincter preserving surgeries for low rectal cancers.